Good afternoon, everyone. Thank you all for being here today. My name is Dr. John Rodas. I'm the president of St. Francis Hospital Medical Center, and it's my pleasure to welcome you all on this important day as the state comes together to launch several new initiatives aimed to combat the opioid crisis in the state of Connecticut. First, I'd like to extend a special warm welcome to our guests, Governor Ned Lamont, Lieutenant Governor Susan Weissowitz, Demas Commissioner Miriam Delphin-Rittman, DPH Commissioner Renee Coleman-Mitchell, as well as Representative Sean Scanlon, Representative Jonathan Steinberg, and Senator Mary Doherty Abrams. Thank you all for being here today. Thank you all for inviting St. Francis to be part of today's appointment announcements as we try to address the opioid crisis that has touched nearly everyone in the state. I want to thank members of the media for being here today as well, as we're going to announce the official launch of LiveLOUD, which is an acronym for Live Life with Opioid Use Disorder, which is an outreach awareness campaign aimed towards connecting active opioid users with treatment. You'll also learn about NORA, another acronym, naloxone and overdose response, a new smartphone app. This really falls under the category of there's an app for everything, apparently, which will provide users with information on opioid overdoses and connects them to nearby locations for treatment for overdose life-saving measures. You'll also hear from Governor Lamont about newly proposed legislation related to prescription opioids. So there's a lot of important announcements that we're going to hear from today. You know, here at St. Francis, we're committed to our mission, which is on the wall behind me, to deliver patient-centered care and be a healing and transforming presence within the communities we serve. And I think this today is a highlight of that mission indeed. So without further ado, I'd like to introduce Dr. Stephen Wolf, the chairman of the Department of Emergency Medicine here at St. Francis, to tell us more about programs we have.
Good afternoon, all, and thank you for being here. We have been on the front lines of the battle of the opioid crisis now for quite a few years and watching thousands of people die from accidental overdose, especially due to the synthetic and now far more potent fentanyl. In 2017, over 70,000 people died in the United States, all from overdoses, more than all of the soldiers killed in Vietnam. Out of those 70,000 deaths, 47,600 deaths were due purely to opioids. In Connecticut in 2018, the figures were just released, there were 1,017 deaths, overdose deaths, 93% involved in opiate. This epidemic has required providers to become more attuned to addiction and the science of addiction, and to understand how even limited narcotic prescriptions can flip the addiction switch in susceptible individuals. It has highlighted the need to alter prescription practices to help prevent addiction, the need for medical education to change, the need to explore better ways to treat pain without narcotics where possible, the need to expand information sharing, and Connecticut's PMP data bank, the Prescription Monitoring Program, is an excellent example of this. The epidemic has also stressed the need and impact for early intervention for those who are actively using. Thank you to Demas, who has collaborated with us and other hospitals, providing the necessary funding to place CCAR coaches, and that stands for Connecticut Community for Addiction Recovery. These coaches play a vital role in getting patients struggling with addiction into recovery. The recovery coaches make initial contacts with the patients in the emergency department, continue supporting them after discharge, whether from the ER or inpatient stay. This is a great program. The coaches have augmented the work of our own amazing crisis counselors and have been doing, our own amazing crisis counselors have been doing, and filled a huge gap that treatment programs can't. That is to keep up outside contact with and support the patient. We know that medical assisted treatment, which is opiate addiction treatment that consists of medications like Suboxone to treat the substance use disorder, is now the gold standard of care for this particular patient population. We again thank Demas, who has supported our emergency department as we led the way in the state, creating a Suboxone program back in December 2017. Through this program, we were able to start a patient on Suboxone in the ER, along with connecting the patient to CCAR. Then we were able to facilitate a warm handoff, quite literally, to an outside treatment facility. This is so important because it means there is no gap. By eliminating the gap, we are helping to prevent the patient from falling through the cracks, waiting for a slot in an outpatient facility. Additionally, DEMAS, once again, has supported our distribution of Narcan to high-risk individuals who may not be ready for treatment at the time they are in the ER. Narcan is important for them and their families to have on hand in case of a future overdose. DEMAS and the Greater Hartford Harm Reduction Coalition under Mark Jenkins have also supplied us with harm reduction kits that contain sterile needles, sterile syringes, sterile supplies, and instructions for help once the patient decides they want it. The work we are doing with the help of DEMAS underscores the need to have different treatment options for different patients and adds to St. Francis's already extensive inpatient treatment programs. One of our core missions at St. Francis, as Dr. Rodas mentioned, is to help those with substance abuse issues. Addiction treatment is not a one-time event, nor can it be the same for everybody. It most often requires multiple attempts before success is achieved, and even in post-treatment, the patient's battle for sobriety is lifelong. It requires us in the medical community to try different modalities of treatment for each patient in the hope that something will click. This requires significant resources and collaboration. I do believe that the tide is beginning to turn to some degree. Public education and awareness has improved. Public misconception about addiction is beginning to change, and more are willing to deal with the issue rather than deny or ignore it exists in their communities or schools. Medical practice and treatment is changing. Organizations and agencies are coordinating efforts with each other. Law enforcement is partnering with the medical community because, as many a police chief has said lately, they can't arrest their way out of this problem. We greatly appreciate the efforts and support of the state of Connecticut and hope it continues. These programs take time to get traction to show success, and these are beginning to show success. For the first time since 2012, the overdose deaths have declined in this state, but there is still much to be accomplished. Thank you.
Thank you, Steve. It's now my honor and privilege to introduce Lieutenant Governor Susan Bysowitz. We know from the beginning that you have been really made the opioid crisis one of your top priorities. You've held many forums and discussions and involved in many levels, so we appreciate it. We look forward to working with both you and Governor Lamont as we move forward in this area. Please, welcome.
Thank you so much. Thank you so much, and I'm honored that we're joined by our partners in government, Senator Matt Lesser, Senator Mary Abrams, Representative Sean Scanlon, and Representative Jonathan Steinberg. Thank you for all of the important work that you are doing and have done on this critical issue. And I also want to thank Dr. Wolf and Dr. Rodas and St. Francis for having Governor Lamont and I today, and also both of our commissioners who are here. Thank you for helping us lead our great state. We heard a few statistics about the problem that we have with opioids, but I want to just highlight a couple more that I think are really important. In 2012, there were 357 drug overdose deaths in Connecticut. And by 2016, however, Connecticut was ranked 11th amongst all states for having one of the highest opioid death rates in the country. So we have a lot to do, especially when you consider that every day in our country, 116 people die of opioid-related overdoses. So we're here today with a message. And the message is that we can overcome this crisis if we focus on education, prevention, treatment, support, and law enforcement. And today is important because every day there is more help available, and we're happy to talk about what we've been working on in our state departments to offer help and support. I have been working with our legislators and with local leaders to tour our state and to listen to law enforcement, to listen to those who are on the front lines of helping to treat those that are suffering from opioid-related disorders. And we've also heard from those who are in recovery and from their families. I just want to say that it takes a lot of courage and strength to come forward. And so, Sarah Howroyd, thank you for having the courage to come forward today and help us reduce the stigma. Nobody should be afraid. No family should be embarrassed. No victim should be embarrassed. We want everybody to know about this important issue. So thank you, Sarah. And I also want to say thank you to our law enforcement community and our EMTs. We had 1,017 deaths in our state, but there could have been hundreds more. But fortunately, we have EMTs and we have law enforcement personnel across our state that saved hundreds of lives. So a round of applause for those EMTs and those on the front lines. So thank you all so much for coming and for helping us get the message out that we have some very important programs and apps and public relations and education-related efforts, and all of us in state government are committed to helping address this crisis. Thank you all so much.
Thank you, Lieutenant Governor. Also joining us today to tell us a little bit more about the new LiveLOUD campaign is the person who's been leading the Department of Mental Health and Addiction Services, DEMAS, for the last several years during some of the most challenging times for the state. Commissioner Miriam Delphin-Rittman has remained focused on her mission and the mission at hand, which is to save lives, to get more people into treatment, and ultimately prevent opioid addiction. Please join me in welcoming Commissioner Delphin-Rittman.
Good afternoon, everyone. I first would like to thank Governor Lamont and Lieutenant Governor Bysewicz for all of their efforts to combat the opioid crisis in our state. In addition to supporting the work of the state agencies, the governor's proposed bill strengthens laws around prescribing, working to prevent opioid addiction before it even begins. In addition to Governor Lamont's efforts, Lieutenant Governor Bysewicz has participated in a number of forums and discussions on opioids around the state, helping to raise awareness and sparking important conversations at the community level. So I look forward to continuing our efforts together to address this crisis. I'd also like to take an opportunity to welcome the Department of Public Health's new Commissioner Designee, Renee Coleman-Mitchell. I understand today is your first day, and so what a way to hit the ground running. So welcome. And I look forward to our work together as well. I'd like to also thank Dr. Rodas and Dr. Wolf and the St. Francis Hospital Medical Center for having us here today for this launch of the LiveLOUD campaign. St. Francis Hospital indeed has been a leader in the state's response to opioid crisis, embracing recovery coaches in their emergency departments, and is one of the few hospitals that have MAT induction in the emergency department. It is without doubt that you have saved countless lives, not only reversing overdoses, but by connecting people to needed medication-assisted treatment and support, helping them on their recovery path and end their life, and helping them to get their life back. And that's what this campaign is about. It's all in the name, Live Loud, Life with Opioid Use Disorder. It's about letting people know that recovery is possible and help is available. That like many other chronic illnesses, there are treatment people living with opiate use disorder and living full, meaningful lives. Every day in our state, nearly 3 people die of accidental overdose. Almost and almost all of those deaths are as a function of opioid-related overdoses. While the reality of the opioid crisis is heartbreaking, it's important that people know that there is a reason to have hope, that every day there are thousands of people with opioid use disorder who are living sober, meaningful lives. This campaign reaches out to those who are actively using heroin or misusing prescription drugs and their loved ones. We want them to know that recovery is possible, that treatment is available, and that support and recovery are just a click or a call away, just a click or a call away. The campaign uses digital and outdoor advertising, such as bus shelters and billboards. In fact, there are a couple of billboards I've been eyeing on 91 that we'll soon be happy to have billboards around the state. Our research shows us that users and their loved ones are seeking trustworthy information and support all in one place. And so we created a website, LiveLOUD.org. It can easily be downloaded on a phone and function as a phone app as well, to provide information not only for those who are seeking treatment, but for their loved ones as well. And we hear that quite a bit, that loved ones also are looking for resources and supports as family members. LiveLOUD.org provides information on opioid use disorder, on different treatment options, on support for families and their loved ones, and many struggling with opioid use disorder. We know, unfortunately, that opioid use disorder does not discriminate. It doesn't care who you are, where you're from, how old you are. Opioid use disorder does not care, but we do. We do. Every life is precious, and we'll continue to fight for those who are struggling with this disease and their loved ones by providing support, resources, treatment options, and making sure they're aware that there is a caring state behind them. So thank you. Thank you, everyone, for being here today.
Thank you, Commissioner. You know, as you just heard, the Live Loud campaign is about people and community, providing them both with hope. You know, when you're a hospital president, you hear stories all the time about success stories where you're giving people second chances. Sometimes it's with cancer, sometimes heart disease. And I think we need to look at this problem the same way. These are diseases. I think you used the term disease disorders a few times. It's not anything different than those others. So I think this is a great program, and thank you so much. There are stories that, there's nothing more compelling than hearing a real story about someone who's endured a situation like this and has come out of it and surviving. And our next guest, Sarah Howroyd, is one of these stories. Sarah is now in long-term recovery from the opioids. She's proof that treatment works and recovery is possible. Since beginning her recovery journey, she's worked to help others living with the opioid use disorder. She's not only co-founded, but also helped design and implement the Manchester Hope Initiative, a partnership with Manchester Police Department that helps connect people to addiction treatment and support. And she's here today with her mother. So Sarah, let me please welcome you up here to share your story.
Thank you very much. Ladies and gentlemen, it's a great honor to stand before you today and to help unveil the Department of Mental Health and Addiction Services Live Life with Opioid Use Disorder campaign. Not too long ago, I could never have dreamed of being here with you, especially in this capacity. Quite honestly, almost 6 years ago to this day, I almost died in this hospital and was given a prognosis of 20% chance of living. But it's precisely why I'm here today, though, to share my own struggles in an effort to inspire others to ask for help. I grew up in a Brady Bunch neighborhood and had an idyllic childhood. I was the product of loving, supportive household with parents who gave me everything I could ever want or dream of. My mother, Lauren, is here with me today, and I cannot thank her enough for never giving up on me, even when everyone else did or suggested that she do the same. I was the golden child. I graduated in the top of my class, but I was in a car accident in my mid-20s that opened me up to become a near casualty of Purdue Pharma's deceptive marketing campaign. And that occurrence forever altered my life. I had to walk through the depths of hell to get where I am today. And the person I spent all of my 20s with died of an overdose just 3 years ago. He was an engineer with 3 degrees in engineering. And at one point, I want to emphasize is that this disease does not discriminate against anyone and can happen to anyone at any time. We're all only 1 or 2 decisions away from this occurring. However, with intensive therapy, medication-assisted treatment, and ample support from both the recovery community and my family, I was able to receive the blessing of a new lease on life. And I'm eternally grateful for that. I am living proof that recovery is very much possible. And as was mentioned, I've accomplished a great deal during that time, but that's the beauty of recovery. You have the ability to come back stronger and better and fiercer than ever before. I'm well aware that I defied many odds in this process and that most people do not come back from such a dark place. But I'm also a living testament to the fact that recovery is very much possible. It's the hardest thing I ever did in my life, but it's doable. And I'm proud to live life out loud in hopes of inspiring others. So if you or a loved one is struggling with opioids, please do not be afraid to live out loud and ask for help. Thank you.
Thank you, Sarah. Sarah also now sits on the Governor's Alcohol and Drug Policy Council and also is on the statewide opioid overdose prevention work group. Thank you so much, Sarah, for that story and the inspiration, I think, to all of us. You know, when you're having a bad day and you think about things you've overcome, you think of stories like that and go, really, my day is not that hard. Speaking of days, I'm now honored to introduce the new Commissioner of the Department of Public Health, Renee Coleman Mitchell, joining us today. First day on the job. What have you done so far? We want to know. You know, we got to get moving here. She's no stranger to, even though she's new in the job, she's no stranger to Connecticut's DPH. She's had more than 20 years experience serving the department in other capacities and has really dedicated her career advocating for the health and wellness and needs of individuals and communities. Commissioner, please come up and say a few words.
Good afternoon, everyone. I will tell you, it is my first day. And if this is any indication as to what it will be regarding being the Commissioner for the Department of Public Health, I might want to rethink this a bit. But all jokes aside, I'm here for a serious reason. I have to tell you that the staff, the very capable staff at DPH, were very clear about the fact that they could present the information today on behalf of DPH. And I said to them, even though it's my first day, it's important because you heard the statistics. There's not a single person I can imagine in this state that doesn't have a family, a friend, a colleague, a coworker who hasn't been impacted by opioid use. I'm one of those individuals as well. So I applaud people like Sarah and her mom who have come forward to share their experience and to learn from it. And that's why I stand here today to talk about what Department of Public Health is about and what we're doing. First and foremost, we're about prevention and education. And that's what this particular app that we are presenting, the NORA, the Naloxone Overdose Response App, is all about. I'd like to take the opportunity to thank the Department of Mental Health and Addiction Services for being our sister agency and partnering, because without all of us being on board and addressing this issue, we cannot get it done. And there's many different ways, and nowadays, as the governor has said in the past, technology and apps are the way to go. I'd like to briefly take the opportunity to invite two of the staff to give you a quick overview of what this app, NORA, can do. If Amy Marizzi and Ramona Anderson can come up very quickly and share with us what this app can do.
Hi, good afternoon. Ramona, did you want to start us off? Ramona's worked very hard on the creation of this app, which seeks to create a tool for people who want to learn more about opioids and how naloxone can truly save a life. By administering naloxone, you truly have the ability to reverse an overdose and bring someone back. I'm going to have Ramona talk about the different features that were built into the app and how it can be used as a tool in different roles. So.
Thank you. Good afternoon. I wanted to say, first of all, it is marketed as an app, but it is a progressive website that downloads onto your phone. I've had a couple of calls already from people saying they couldn't find it in their app store. Go to www.norasaves.com. go to the website and you'll be able to save it to your phone. It will then function as an app on your phone. If there are any updates, it will automatically prompt you to reload it. I want to thank Connecticut Interactive for all the work that they've done, especially the graphics work that Darcy St. Amant has done. If you look at the first 4 panels, the signs of an overdose, overdose response, how to give naloxone, and I gave naloxone. If you go through those first 3, there are going to be slide sets that present to you the different steps to take. So if you do come across a family member, a friend that's overdosed, you'll be able to identify it. What should you do next? The biggest message we want to tell people, this app is a tool, but it does not replace a first responder, a medical professional. Call 911. Something else could have happened. In your best judgment, you're trying to provide help, and that's where your legal protections will give some background on that. The Good Samaritan law will protect you. If you are working in good faith to try to save someone's life, please try. The I gave naloxone section will ask you for information. We're trying to get a better handle on how much naloxone is being used in the state. Right now, we don't have a way of measuring if someone picks it up from their pharmacy, if it's been used. You might have it on hand for a few months, and that's the other reason we have this tool. It gives you reminders on how to properly use it, but we also would like to get that back. We are the Department of Public Health. We work with a lot of data sets, so we'd like to get that information. The How to Give Naloxone describes, and we say naloxone, a lot of people don't even know what naloxone is. Naloxone is kind of like a cotton swab where Q-tip is the brand name. People think Narcan is the only type of naloxone. There are 4 types actually. So if you go to How to Give Naloxone, you can see what type of prescription you've picked up from your pharmacy, identify it, and it'll explain in the panels how to give those different types. It will also tell you about rescue breathing and how to give CPR, and we encourage people to get training in CPR because it does arrest a person's respiration, and we want to make sure that person is breathing. Under naloxone and where to find it, it connects to the Department of Consumer Protection, another active partner of ours, and it will let you find where naloxone is available in your neighborhood. All you have to do is hit the GPS button and it will walk you to that location. We recommend you call them, make sure that a person is on staff that can give you training on it. Prevent opioid overdose, and what our opioids will give you more background information and links. And one of the most important things we did add on last week was Prevent Opioid Overdose has a link to the LiveLOUD campaign. So thank you.
I think with that last statement, it just shows our commitment in working with our sister agencies, and we're very dedicated to addressing this opioid overdose response. Thank you.
Thank you all. That's great. So it's now my distinct pleasure to welcome the Governor, Governor Ned Lamont. In your first few months of office, Governor, it's been clear that you're willing and able to take this issue on firsthand instead of kicking it down the road, and we really appreciate your commitment to this important issue. So thank you, Governor, and please, I welcome you to say a few words.
Well, Miriam, how's it going so far? Been here. Renee, thank you for being here. Two hours so far? Well, we got a lot of work we got to do, so I'm glad you're hitting the ground running. And Sarah, you know, you remind us why we're here every day. Proud to have a small role because you inspire us so much. And this is why it's so important that we get this second chance and we do everything we can to make people believe. That's what this campaign's about. Make people believe that, you know, they can do this too. I was here some months ago with Patrick Kennedy, and we went to the intercommunity facility here, Dr. Rodas, and it was so inspiring. And we met some folks who are, you know, in recovery, and I said, I'm Ned Lamont and want to be your governor, and they said, that's great. And I was with Patrick Kennedy, and Patrick Kennedy said, I'm in my 7th year, 30th day of recovery. Every day is an opportunity, and I want you to seize that opportunity every day. And these folks stood up and cheered, and they believed what a difference we can make when we give people the right tools and opportunity. That's what this app is about, developed here in Connecticut. We're often talking about getting our government a little more digital. Let's make sure that people know when they're in this in a crisis. You can go to this app. They can figure out what you should be doing. They can figure out where the closest treatment is. This is how we make government serve people in a way that's meaningful. I can tell you that in our budget, it's a modest budget, but we can do so much better. I mean, look at the money that poured in, for other public epidemics, and we're just catching up now in terms of what we can do with the opioid epidemic. And we got to do more here in Connecticut. Let's be blunt about this. Connecticut was ground zero of the opioid epidemic. A lot of this stuff was designed here in Connecticut, it was marketed here in Connecticut, and we're going to take the lead in making sure that people know they get a second chance. And that's what we tried to do. I mean, we've got money for marketing. We're here to announce a $5.8 million grant coming from the feds in terms of what we can do to get treatment and outreach closer and closer to the community where it's got to be. We put money into opioid treatment for folks in prison or getting out of prison. It was remarkable to me that over half of the opioid deaths in the state of Connecticut were related to people who had served some time incarcerated. It was amazing to me that they were 10 times more likely to die of an opioid overdose during that month or so after leaving prison. And if you really care about people, you really care about a second chance, these are the ways that we can make an enormous difference. So I just want you to know that, Sarah, your inspiration, what we're doing in public health, what we're doing in mental health, here at the hospital, and what I can do from the governor's office with Susan to let each and every one of you know that we're going to be here fighting for you. Connecticut was here as the beginning. We're going to be here to make sure that each and every one of you get that opportunity. That's my pledge to you, and that's why I'm so proud to be your governor. It gives us a chance to make a difference in people's lives. Thanks, everybody.
Thank you so much, Governor. So I want to thank all of you for being here today as the governor and the legislature and lieutenant governor, the commissioners, and thank you all for being here today as all these new initiatives are launched. If you want to learn more about the NORA program or LiveLOUD, there's tables behind you. I welcome you all to stay. Thank you all for coming to St. Francis Hospital today. Thank you all.